So, I want you to imagine you're a frontline social worker. Your day is filled with complex situations. Your time is being pulled in several different directions, yet the decisions you are making are going to deeply impact the lives of your clients. Now, this is a challenge we face in social care. I still remember the first family I worked with as a newly qualified social worker. There were concerns about domestic abuse, substance use, and mental health. And I recall the drive over to their home, running through the referral and my training. But as I knocked on the door, I remember thinking, but how am I going to do this? How am I going to address the concerns, but also build trust? How am I going to assess the risk to the children, but also understand the issues the parents faced? So I knew then the complexities of social care had begun for me. So let's fast forward to when I'm working in the adult safeguarding team. And on this particular day, I was on duty, meaning that all referrals come my way, and I'm going to make my decisions within 24 hours. Now, I'm already juggling multiple referrals when I feel I'm reaching that in-control phase. So my in-control phase is where I formulate a plan on each referral. So I'm just feeling confident, thinking I've got this, and then another 4 drop into my inbox. So as I'm reading my referrals through, I'm prioritising as I go along. And I notice that 2 of them require immediate action. So I'm crossing my fingers and hoping the Public Protection Unit are waiting for my call because we really do need to move fast. Now, this is the reality of safeguarding, where our decisions are complex and they normally need to be made very quickly and often on incomplete information. It's intense, it's urgent, and every decision is important. But as a practitioner, I felt knowing the research base gave me that confidence to make these types of decisions. Now, we all know research-informed practice is the gold standard, but embedding it into everyday practice has always proved a problem for busy practitioners. So this is why myself and Rachel Schofield were set out to create a model that makes research-informed practice a part of the DNA of social care. So today I'm going to say the analytical map framework of how we use research in practice to empower both the practitioner and client alike. But first, let me tell you why I became so passionate. A few years ago, I was working as a safeguarding lead coordinator, chairing strategy meetings with a wide range of professionals. And in these meetings, our goal is always the same: to create a protection plan that best supports the client to keep them safe. But I noticed while other professionals confidently use research to support their recommendations, the social care professionals did not. So when we encountered professional differences, as we did many a time, we did not have the same influence. So I would try to tease out the reasoning, but it never matched the research-informed plan. And I also knew from experience, social care workers did not have the same access to research either. So this became frustrating, but it also sparked my desire to change how we in social care make our decisions. I knew that we needed to bridge the gap to empower our social care workforce to be just as confident, just as evidence-based as our colleagues. So this is why Analytical Map was developed. It's about giving our practitioners the tools they need to make robust decisions. Now, I was fortunate to obtain an NIHR Practice-Based Research Leaders Award to champion a research culture. So let me tell you how we did this. We worked with 3 pilot teams: the Complex Disability team, the Neath Network team, and the Occupational Health team. Now, imagine yourself in one of those teams. Maybe you're feeling excited because you've always wanted to use research, or you might feel a little apprehensive or even a little resistant. You're not alone. One practitioner explained how he wanted to take his journal club to the next level, where others were worried that they had to have an addition to their job. Or you might be feeling a bit worried that the research base is now going to trump all your decisions. But this is where the analytical map comes in. The process allows you to weigh up the information so that you can make a robust decision with all the options. So I'm going to introduce you to the 4 phases. Yes, there we are. So firstly, you're going to complete training on how to incorporate research into your practice. Next, you then attend a case mapping session. So this is where we map out the research base on your case to inform your decision making. So you're going to walk away from that session with research to consider and an action plan. And now your supervision is going to change slightly. So there's now going to be an expectation on you that you will discuss the research base to explain your decisions. And then lastly, we knew that in order to sustain this research culture, practitioners needed the right tools, like an A to Z for practice. So we developed a toolkit, an easily accessible resource that provides quick access to key research summaries and other practice tools. Okay, so let's have a look at the structure of a case mapping session. So we unpick the client situation together and then we apply the research. So we consider the individual's outcomes. So this is what the person would like to happen and their understanding of the situation. And this can help us work out what the client needs to know as well as the practitioner. And then the circumstances, so which is a summary of what's working well and what we are concerned about. We consider existing strengths as well as complicating factors. And then there's the research base, which includes what evidence base will aid our thinking and decision making. And then we form the next steps, like an action plan for the practitioner. So I would invite you to think about how you could hold your own case mapping session. So think about a decision you have to make, and then you need to break that decision down. And then you work out what you already know, then what you do need to know to make that decision robust. You can then apply the research base to make the decision with confidence. So what did we learn? One of the most powerful insights came from practitioners themselves. They shared that integrating research into their practice not only improved outcomes for their clients, but it also boosted their confidence. They felt more empowered, more knowledgeable, and more assured in their roles. So one social worker shared, "I'm waking up at 4 a.m. worrying about my client." But after attending the case mapping session, she felt she'd been able to share all her concerns and had a plan to go forward. And in her words, "I'm going to rock this meeting for my client." And then client feedback included that they had a better explanation of the options and why people were recommended decisions they were making. One client commented, "I now know what everyone does. I've always been muddled with who's who and what is what." Now, by adopting this model, we were able to show that research doesn't have to be something distant or disconnected. It can be a daily part of social care. Research isn't meant to sit on a shelf or live in a journal. It's meant to be applied to help us understand the circumstances and outcomes for our clients. It informs our thinking and our decision making. Now, the pilot teams hold their own case mapping sessions now. We slowly stepped away and created a peer support community for those leading the session to support each other. So though trialled in adult social care, our plans are to replicate the model in children's services. And if there's one thing I'd like you to take away from today, is that research-informed practice is not an unattainable ideal. It is achievable. We just need to create the right structures, the right support systems, and the right culture to make it happen. So I ask you to join me in supporting a research culture. Together we can drive meaningful change for each other. I think the question is now, how are we making decisions without the research base? Let's make research an everyday part of social care, and let's do it today. Thank you.